Simple solution to the complex problems that intersect here: addiction, mental illness, and homelessness.
We've seen this situation spiral out of control during the past 5 years. It's a complex problem, and the city's plan isn't working. It's impacting businesses, residents, and the hundreds here on the street.
There's always something going on here.
Needles line the ground as dozens struggling with drug abuse line the sidewalks in the area of Boston known as
Methadone Mile.
Methadone Mile.
Methadone Mile.
Methadone Mile. People in the throes of addiction in the midst of a pandemic, filling needles with deadly drugs, shooting up, not wearing masks, and sometimes crowded next to each other inside these so-called comfort stations.
Community group that says the problems are getting worse.
This is the intersection of Melnick Boulevard and Massachusetts Avenue. This small intersection does not look different from others when we first met it. It's just another neighborhood located besides Boston University's medical campus and Boston Medical Center in South Boston. But when you drive past Melnick Boulevard, everything changes. Tents, carts, and messy clothes indicate that lots of people are living here, while used needles on the ground tell you about their hard lives in a cruel and straight way. Yes, this is Mass and Cass, also known as the Methadone Mile. This area is where open-air drug markets, methadone clinics, rehabilitation programs, and drug treatment centers gather around. In this area, addiction and struggles intertwine with stigmas and stereotypes and grow under the shadow of New England's busiest trauma hospital. It is ironic and heartbreaking at the same time. Most people who live in this area have one thing in common: substance use disorder. They are either struggling with addiction or finding a path towards sobriety. That is also where the name Methadone Mile comes from. People here are using methadone to treat their opioid use disorder. We believe that a major part of understanding this problem and trying to prevent this in the future is through education. This is why we went to addiction specialist Dr. Kane, who helped us explain in more detail what those struggling with substance use disorder are faced with. What are some physical symptoms of withdrawal?
For opioids. There's there's muscle spasms, myoclonus, which they'll often do if they're feeling so sick they're in bed and their legs will kick, and that probably led to the expression "kicking the habit." The most widely used treatment in this country now is called Suboxone. There's a ceiling effect, and it will never give you as big of a high as what's called a full agonist, like heroin or Vicodin. So the idea is like a step down. One of the hallmarks of opioid addiction is that relapse rates are very high. So people need to stay in treatment, either with something like Narcotics Anonymous or with therapy like they give you at the methadone clinic. When you go there, you don't just get methadone, you get talk therapy. I'm not saying that people can't kick the habit and stay clean for the rest of their lives. What I'm saying is that it's very common for people to relapse eventually. And that's why some people go to Narcotics Anonymous twice a week for 40 years.
Why do you believe there's such a high rate for a relapse?
We all want to know the answer to that question. I tend to take a behavioral science view. The answer is likely to be that once they have learned this habit of taking the drugs, once they do that and they do it repeatedly, the behavior becomes reinforced. So we think it goes from being a sort of decision-making process to a habit, and you don't really think about it, you just do it. So here's a myth busting. So the methadone isn't really what cures you of addiction. What they do is you go to the methadone clinic, and first thing when you get there, they give you a little cup of methadone and you drink it. And by taking it orally, instead of snorting it or injecting it, it brings the high down a little bit and stretches it out over a longer period of time. So you're not as intoxicated, but it lasts longer. And that helps you to feel like you're not sick, you're not going through physical withdrawal.
How would you describe the relationship between substance use disorder and mental illness?
If you are diagnosable with major depression, it's very likely you're also in trouble with substance use disorder. And so a lot of people will speculate that the people that are suffering from depression or anxiety are self-medicating, taking the drugs to feel less bad, to feel less depressed or anxious. And that gives you the comorbidity of the psychiatric, the real mental illness, the most common being anxiety and mood disorders with substance use disorder.
If you're in recovery and you have no, you've burned all your bridges with your family, you're living in a homeless shelter or you're living on a friend's couch, the job you can get is working at Dunkin' Donuts or Stop and Shop. That life is really difficult. You've just come out of years of numbing yourself because life is so hard. And then you're sober, then you're in recovery and life is even harder in some ways. The temptation to go back to that, to numb out again, is really strong. One of the main reasons why they gather there is because there's a lot of services there. And I think that's a story that is not always talked about. Down there you have 3 homeless shelters. You have the city's, New England's largest needle exchange harm reduction program. You have access to care programs, which place people in treatment. You have the city and probably the state's largest hospital for the poor. So because there's so many resources down there, and because people are down there accessing things they need, you have methadone clinics. It's kind of a logical place, and also there's a lot of kind of dead space, or space where people can kind of hang out or congregate, and it's also that's a really interesting area because it's right in the heart of like 3 different or 4 different neighborhoods. So I think it's just kind of like it's one of the few areas left in the city that's not completely developed. So I think that it's just that paired with it's the area where all the services are, it makes it kind of the prime location for people to congregate.
People come here for treatment and hope while battling against drugs and poverty at the same time, but the recovery process is hard. As time passes, people start gathering in this area.
These people, the Surgeon General, especially the last Surgeon General, talks a lot about something called diseases of despair. And that's like addiction, depression, suicide. We're in really tough times in the country. It's especially difficult for poor people, for people of color. Increasingly, you see people are figuring out ways to deal with pain, right? And one of the kind of foremost ways to deal with pain is to use drugs. But the problem is there's a big gap between, a lot of people think of like you just go to rehab or something like you see in a movie. You just go to one place for 9 months and then you're in treatment. That's not the way it works. The way it works is you go to detox, which is where you get the drugs out of your system, but that's only a day or 2, and maybe a few more. Then you're back to wherever sometimes the detox will place you into that next level of care, but a lot of times there's not a bed available right away at the time that you're about to get out. So where do you go? If you're housed, you go back to your house and you wait it out. If you are not, you go to a homeless shelter or the street or a friend's house. And then you're kind of waiting for that next, you're checking in at your program every day to get that next bed. So because it's kind of like a bottleneck, like there's actually enough detox beds, there's a lot of detox beds, but those next levels of care, the further down you go, there's less and less beds. So because of that, I think if they are serious about getting into recovery, they have a hard time kind of accessing that chain.
Nowadays, Mass and Cass has become an emblem of both humanitarian and drug crisis. Media is pulling spotlights and cameras on this tent city, while government is casting around desperately to find a solution.
To be clear, tents are not appropriate. To understand that some individuals may refuse help that they've been offered. In this instance, enforcement will be used, but only as a last resort.
When it comes to the piece about where we house folks who are needing treatment, we cannot have a criminalization lens. We must have a public health focused lens. And so what I take from this conversation is that there are facilities, empty buildings that are available. Let's make sure that we are not leading with law enforcement, administering programs, but we have a public health lens and use every resource on the table.
For the people outside Mass and Cass, we can definitely do something to help address what is going on around in this area.
So what I always say to people is, can look up the providers in the area, connect with them. Many of them have volunteer nights or volunteer opportunities. Go talk with people who work there every day, who have been working down there for years, and say, how can I help? As opposed to just kind of like taking it on yourself to just go do something, which I think people are trying to do the right thing. But if they went down and met with staff at A-HOPE, which is the city's harm reduction program, or Healthcare for the Homeless, which is a great provider down there, and said, hey, I really want to help. I'm a student. I have these set of skills. I have this time available. How can I help? And then I think they'll tell you, there's volunteer night.
Mass and Cass is just a miniature of the opioid crisis that Boston, Massachusetts are dealing with right now. The state of Massachusetts reported that opioid-related deaths had increased 450% since 2000. In 2016, the CDC revealed that Massachusetts had the third highest fentanyl-related death in the US. Moreover, 2019 study from the CDC also stated that Massachusetts ranked top 10 in the drug-related death rate in the United States. While paying attention to the methadone mile, we should shed some light on the drug abuse issues in general. Otherwise, there will be another Mass and Cass in the near future. What struck us most when we were in this area was that we didn't feel as though we were in Boston. We felt we were entering a completely different world than the one that we were used to seeing. Everyone was suffering, and all we could think was, how does nobody know they are here? Nobody knows they are suffering. They are pushed aside. Even though we cannot feel the same way as these people who are struggling with drug addiction do, we can still help make changes. We believe this change starts here, showing a little part of these people's lives and prevent substance abuse through education.
So I started abusing drugs when I was about 14 years old. I was at a hospital. I had just gotten surgery and they gave me morphine. Now my father being a drug addict, I was born with this disease because drug addiction is a disease. And it is actually the only disease that will tell you you don't have a disease. Like any other disease, there is medication for it, but not for drug addiction. There are just ways to cope with it. And, this was never part of my plan either, to become addicted to any narcotic. But, sometimes in life things just happen. And, I started smoking weed after that, and then I started playing with pills, and that's where I really fell in love with my addiction, was when I started using pills. It started off with benzos, as in Xanax, and it progressed to opiates, and I think that's where everything went downhill, was the opiates. And I started doing that for a good 7 years, and it took a big toll on a lot of people that I love, and my family, and the ones I care about, friends. A lot of friendships I had ended because of my addiction. And it was just a very tough phase in my life, but I did not believe there was much more for me but to keep living a life full of addiction. And when you're going through it, you don't really know you're going through it. You just kind of go with the flow. And what made me want to get clean actually was my manager at this job I work at now. I work for security at Allied Universal. And My manager recognized that I was under the influence and asked me if I was abusing drugs. And it was to the point where my body physically could not take it anymore. I didn't look this healthy. I actually looked a lot worse. My bones were sucked in more. I looked malnourished. It was very pale. And you could just tell, you know. And my manager was like, I can give you two options. You can either A, go to rehab and get help, or 2, take this drug test and fail. And, you know, I fire you. But at the time I was using fentanyl, and I knew that the drug test he had was not going to find any fentanyl. But more than anything, I was tired of living the life I used to live. It became a full-time job that did not pay very well in any way. It just paid me in misery, and it used a lot of my money, actually. I was spending about $150 a day on just 5 pills. And that was a daily cycle. So I have to give thanks to my manager for helping me get clean, and myself, most importantly. Yeah, just the tiring. It gets so tiring. And it's fun for a very long time, don't get me wrong, it is. But until it's not, and then it becomes a full-time job, you're not gonna have fun. But I'd have to say the hardest part in this whole recovery thing is definitely staying clean.